Good afternoon and welcome. I am very pleased to welcome you to Care for the Homeless's Ending Chronic Homelessness, What We Can Learn from Houston's Success Spring webinar. I'd like to start by thanking our very generous sponsor, MasterCard, who provided significant financial support for this event. We are very grateful to MasterCard and all the support that they provide to care for the homeless. On a single night in 2023, over 650,000 people in the United States were homeless. That's 20 out of every 10,000 people in our country. And if you extrapolate it from that single night, that point in time count of 653,000, we believe that there were well over 1.2 million people who experienced homelessness at least once in the course of 2023. That's a startling number, and much of the media attention to this social problem is focused, understandably, on East Coast and West Coast large cities where there are large concentrations of homeless people. But this is, in fact, a national problem. And I'll point out one piece of information that I think demonstrates the fact that this is a national problem. Only 25% of the people in the United States, or the households in the United States, who are eligible for rental assistance through the Section 8 program actually receive it, just because of an arbitrary cap on the program that is set by Congress. And so this is a national problem that manifests itself in multiple municipalities in the United States. We have had at Care for the Homeless a long series of seminars, and we've focused, quite frankly, on what's going on in New York City, our street homeless solutions, our shelter solutions, mental health services, and other issues that really impact homelessness in New York City. But if this is a national problem, we really need to be prompting national conversations. And the genesis of this particular seminar came through a wonderful article written by Michael Kimmelman in the Times last year, in which he detailed the extraordinary work done in the city of Houston in terms of reducing chronic homelessness. And so we thought that this would be a perfect opportunity to prompt a more national discussion and do some comparison and contrast about things that are happening within two different cities, a large city and a moderate-sized city in the United States. I'd like to begin by just going through a little bit of level setting in terms of data, and let folks know a little bit about the two cities that we will be looking at this afternoon. So if we could begin the slide presentation, that would be great. Thank you. Next slide, please. So this slide lets us know a little bit about what the different populations are. Chris, if we could make is it possible to make that bigger on the screen? If not, I'll just continue with it. And so you see, of course, that New York has a much larger population than the city of Houston. Next slide, please. This is a slide that compares and contrasts Houston and New York on what is called the point in time count. This is the annual count done in January, and it's a fairly comparable methodology across the United States. And so you can see, again, that this is a very much a disproportionate presentation of homelessness in each of our cities. In New York City, the problem is obviously very significantly larger than Houston. This includes both sheltered and unsheltered homelessness in both cities. Next slide, please. This gives you the breakdown of sheltered and unsheltered homelessness. One thing that we can see here is that New York City has a very large shelter system vis-a-vis the overall population in the homeless population in the city. And so this is a plus for New York City in many respects compared to places like Los Angeles. We have a very large homeless population, but they are largely sheltered. Los Angeles, you would see kind of the reverse of this. You would have a comparable sized homeless population, but most of them would be unsheltered. Next slide, please. I won't go into great detail on this slide, but it does give you a sense of what the different homeless system components are in both New York City and in Houston. You can see, of course, that New York City has a much larger shelter system. Houston has a smaller problem and a smaller shelter system. But one thing to point out here is that you can see that in Houston, there is a bit of a concentration of responsibility under a single entity, or a single entity that's overseeing a group of organizations working on the same problem. And that's a little bit different than New York, where we've got many shelter providers, many homeless service providers, obviously working under the leadership of New York City. But Houston has a fairly concentrated set of responsibilities with respect to executing the plan to address homelessness. Next slide, please. So one issue that we're going to address today is Houston's focus on rapid rehousing as an intervention. And so what this does is kind of give you a little bit of a baseline on what the different vacancy rates are in New York City and Houston. As you can see here, the vacancy rate in New York has, in recent years, most recently in last year, fallen to just about 1%, a little bit over 1%, which is kind of a shocking vacancy rate, a much healthier vacancy rate in Houston. And this may be one of the factors that we'll have to address this afternoon as we think about applying some of the solutions from Houston to New York. Next slide, please. And this is a slide that demonstrates the deficit of affordable units at or below what's called extremely low income levels of affordability. And so if you're an extremely low income individual or family, it's obviously harder to get housing in both New York and Houston. But you can see that the deficit of units in New York is many orders of magnitude larger than the deficit of units in Houston. And so, again, this will undoubtedly factor into the conversation this afternoon. Next slide, please. And one of the key, since we're addressing chronic homelessness this afternoon largely, although we'll talk about homelessness more broadly, one of the key interventions, one of the evidence-based practices is, of course, permanent supportive housing. And that is an intervention I'm sure most of you in the audience know is targeted to people experiencing chronic homelessness, very often targeted to people with serious mental illness. And New York has a very large inventory of permanent supportive housing. Houston has a somewhat smaller, but again, proportional to the population of people experiencing homelessness in that city. Next slide, please. So just as a kickoff, we'd like to get a little bit of a sense of who's participating in the webinar this afternoon. And so we'd like you to just fill out this poll in a minute or so and let us know what your professional role is in the field that that's represented here on the slide. And if you could just check the box and submit your answers, we'll tabulate them fairly quickly and let you know who is in our audience this afternoon. So thank you for doing that. Results are coming in. Through the miracle of modern technology, we'll be able to tabulate these very quickly. If you haven't submitted yet, please wrap it up and submit your category. So as we can see here, a little bit over a third of the people who are in the audience this afternoon are employees of a homeless service provider. We've got social service providers as well and healthcare providers. Very pleased to see that 10% of the people in our audience are folks with lived experience of homelessness. So we welcome you and thank you for participating. We want to listen to the voices of people with lived experience of homelessness, and it makes us better at our jobs. So welcome. We've got some government representatives and some policy advocates. So that gives everyone a sense of who's in the audience this afternoon, and thank you for participating in that poll. It is now my pleasure and privilege to introduce the person who will be moderating our presentation this afternoon. Michael Kimmelman is the architecture critic for the New York Times. He has written about public housing and homelessness, public spaces, landscape architecture, community development and equity, infrastructure and design. He's reported from more than 40 countries and has been a Pulitzer Prize finalist twice. He's also, and this is one of the reasons we thought Michael would be a wonderful moderator this afternoon. He's also the founder and the editor-at-large of Headway, which is a small team of journalists focused on understanding where communities are in addressing some of the most serious long-term issues facing municipalities, including homelessness and the lack of affordable housing. It is my pleasure to introduce Michael Kimmelman.
Thank you, George. It's a pleasure to be here, and I wanted to say how honored I am to do this, and how glad I am to see that there's a large crowd of people here. So let me start off by introducing who's here with you today, and then I will hand this off to the Houston group to explain what has been their policy and success story so far. So let me start with introducing Anna Rausch, who's the Vice President of Program Operations at the Coalition for the Homeless of Houston. Hi, Anna. Mandy Chapman-Semple is the Mandy Chapman-Semple. Sorry, Mandy, is the managing partner at Clutch Consulting Group, and Mandy will tell you, I'm sure, about all the places she has worked and continues to work, which extend far beyond Houston. Mark Eichenbaum is the Special Assistant to the Mayor for Homeless Initiatives in Houston. And I believe Mark and Mandy worked together during an earlier administration in Houston. And from New York, we have Alex Magana, who's the Program Director for Street to Home Queens at Breaking Ground. Amy Pospisil is the Chief Operating Officer at Breaking Ground. Cassandra White-Hemphill is the Deputy Commissioner for Street Homeless Solutions at the New York City Department of Homeless Services. And Cynthia English is a lived experience advocate and former shelter specialist for the Coalition for the Homeless in New York City. So it's an incredible group of people to be having this conversation. Let me start by turning this over to the Houston team and asking you to describe a little bit what you've been doing there for all these years.
Good afternoon, everyone. You can go to the next slide. So talking a little bit about our community, in 2011, we were not doing a great job. We had the 5th largest homeless population in the nation. Our homeless service providers were spending millions of dollars, but still leaving a lot of federal funds unspent, and we know that's a big no-no. Homeless service providers were operating in silos with no collaboration. At that time, I was actually working for a different nonprofit, and no one really knew what the other nonprofits were doing, what other service providers were doing. We didn't know what the lead agency was doing or the collaborative applicant. No one really understood what it took to apply for a new permanent supportive housing project. Our recidivism was very, very high. We were not matching individuals to the right intervention. The housing ready philosophy that was abundant at that time was keeping those really hard to serve people on the streets. And then we all know that homelessness is expensive when it comes to responding to homeless services with emergency services, but not with permanent housing. So something had to happen in order to get us on the right track. Next slide. And so back then in 2012, HUD had a priority communities initiative that they'd launched. And it was to help communities that were struggling. And so Houston was identified as a priority community, which was not necessarily a good thing. It meant that we really needed some help. And so that brought some technical assistance in the town. Is actually when we met Mandy. She came in as a TA provider along with another TA provider. And so we had this huge community charrette over several days. And we brought everyone together, everyone that touched the homeless response system. So for example, the public housing authorities, the VA, the public hospitals, the largest mental health provider, homeless partners themselves. And we had people from the lead agency or the collaborative applicant. And we all came together into the room to try to figure out what we were doing wrong, what we were doing right, and how we could kind of move things around and shift to where we were doing things the right way. Next slide. And so this call to action that happened was really about how we were going to transform our homeless services into crisis response systems to prevent homelessness and really get people housed as soon as possible. So we needed to shift our paradigms. The way that we were doing things before was we were a diverse collection of providers using different methods and providing different services, using service delivery models that tended to trap people in homelessness. And we needed to shift to this integrated network of providers whose efforts were well coordinated, and that we were using housing to really impact and serve the most vulnerable in our community. Next slide. And so this evolution to a coordinated system was really, all about collective impact. So it was about individual change. So we had to remove barriers that kept people from getting what they needed. Collective change, coordinate and simplify access to housing services and to all the different interventions that we were setting up. We had to enhance collaboration amongst funders and partners. And so, for example, if the city of Houston put forth funding proposals, it was something that the community needed, and not just because they were putting out a funding proposal for anything and a partner was applying. We needed to get to be data-driven. So we needed to change our system to build capacity, match resources with the needs, use data to drive decision-making. This is very, very important. We're very data-driven in Houston. We are the HMIS lead, and so we lean heavily on the data that we have at our disposal. And then, of course, implement. So we didn't need to get paralyzed in planning alone. We need to course correct as things were going. We like to say we're building the plane as we fly it. And so really these changes allowed us to fully leverage our federal resources, add units to the homeless response system, and begin to see the reductions in homelessness that we really, really needed. Next slide, I'm going to pass it over to Mark.
Thank you, Anna. And so, after being, we had kind of this aligning of the stars that Anna talks about. While we had historical high levels of homelessness, we had a mayor that wanted to really focus on it. We had a community that realized we were spending millions upon millions of dollars, but not ever really achieving reductions. Being named a priority community, which was kind of like putting us on notice by HUD. And we had the private sector that really wanted to be a part of something special, creating transformative impact. And so that led us to creating a new 5-year plan. And we held that, a large 3-day community charrette that Anna mentioned for that new plan, really focused on creating new units of supportive housing, specifically permanent supportive housing at the time. Really wanted to focus on permanent supportive housing at the time, being most vulnerable, most visible, the high cost utilizers. And while we were doing this, starting in 2012, we started to launch and work on really utilizing coordinated access. Now, everybody can has to use coordinated access, but not everybody uses it in the same way. But we really wanted to make that the single front door for agencies to receive referrals for housing, as well as for the clients to be able to be referred to that housing. But you can see that, we kind of got started even before we did the large rollout of our coordinated access system. And it did help that we had some kind of proof points, some demonstration projects here, and we really utilized veteran homelessness for that. Backing up, when we started this all in 2012, a group of folks from different agencies all came around a table in person, working off of a spreadsheet, and said, can individuals experiencing homelessness actually be housed and stay housed? And can we do that by just working together? And we every goal that was made as part of the White House's focus on reducing veteran homelessness, we achieved. And it was kind of that proof point to the community that we could do it. We were capable of doing it. And the housing first interventions, while the data was there, we can actually see in real time in our local community that it can have an impact. And that led us to becoming the first or the largest major city to effectively end veteran homelessness in June of 2015. That's where you see that picture there with the mayor, some folks from Congress, and three federal secretaries. And then that really propelled us to take those lessons learned, bring it to scale, expand it beyond veterans, and that's what helped us, cut homelessness in half. Next slide, please. To do this, it's that three-legged stool. You have to have the housing unit. You have to be able to pay for the rental assistance. And you have to pay for the services. And so when we focused on the actual units, we do, both the city and Harris County, do invest in building supportive housing from the ground up for predominantly communities who have experienced homelessness. However, we don't have enough time nor money to just build from the ground up. But these are some examples. Obviously, just like New York does, when we are investing taxpayer dollars into it, we want it to add, not detract to a community. And we're going to make it as first class as we can. But once again, we just don't have the resources nor the time to bring it to scale to have that impact that we're looking for. So we go to the open market. Next slide. And so, we are looking at units in your mainstream competitive multifamily apartment market, and they can be spread throughout the region. And so, some of these little greenhouses you see, we may have 20 units. Some we may just have 1 or 2 units, but we're going to go out and try to get units wherever we can. The majority of our permanent housing units are part of the open market because we have to house people today, not tomorrow. We're building for the future, but we want to house people today. And that's where it's public-private partnerships, working with private landlords to get them to be part of the solution as well. Next slide. The services is a key component. I'm preaching to the choir here. So many folks already know this, but the services is what keeps the person housed. And the housing is what makes the services effective. Before, we used to be really focused on responding to homelessness, not reducing it. We were focused on managing it, and we would provide a lot of services to people on the streets. But when a person doesn't have that safe and stable location to reside in, they're not going to fully intake in those services. The services are not going to be impactful. But once somebody has a safe and stable location through housing, those services can then be a launch point, can be really successful. And the services, once again, keeps the person housed. We will never house somebody without the services. Next slide. And so this is just a little demonstrative. If you can click on it 2 more times, to take folks on the streets and put them in a temporary solution like a shelter does cost money, but that's temporary. The next question is, then what? And so usually to get them out of the shelter, so that the shelter can serve more people as well, you have to get them into housing, and that takes another big investment. So here we have huge investments being made, one into a temporary one, but then you still have to focus it on the long-term one. If you can press it a couple more times. What we do in Houston is we try to take all the money and we put it into the long-term solution, which is housing. And this isn't to say that shelter is bad at all. Shelter plays a very important role, but we try to make sure that for every dollar that might go into shelter, that we're putting in 25 times, if not more, into the long-term solution. A lot of times the shelters want the housing in the long-term solution because the shelters, if not, the shelters end up being a place where folks could be living for years, even though it was designed maybe originally for weeks, if not months. But another way to look at this is that it's sometimes, you can double your impact by taking your dollars and investing in the long-term solution, or it's twice as expensive to focus on the temporary solution as well as the long-term one. So in Houston, we don't have any really, most of our shelters are not publicly funded because we don't have the funding. We choose strategically to take the little public funding we do have and really focus on the long-term solutions. But once again, shelters are important. Shelters play a role, but they're not the long-term solution. And we really make sure that there's strategic investments and it's done at the right proportions. Next slide. COVID was a talking about creating an opportunity from a crisis. And so, Houston is unique is that we really don't have any local general funds from the city that goes into homelessness. Well, the state also provides only minimal funding. And we're also not a Medicaid expansion state. And so, the story of Houston, while we may have lower populations and size, and by the way, our homeless response system serves the greater Houston area, which is around 7 million people. And so when you don't have a lot of resources, we were looking at potentially having increases in homelessness unless we could find some. But then, as perverse as it sounds, the gift of COVID happened, and we saw this was a crisis, but we have to turn it into an opportunity. And we predominantly used our COVID funds to get people out of homelessness, to focus our COVID funds on housing, how to protect folks and mitigate them from the short-term crisis of COVID, but get long-term benefits of getting them out of homelessness and reducing homelessness for the region. Next story. Next slide. And we used the COVID funds to really even focus encampments. And the question, how did we go? How did we respond to encampments? Well, we holistically decommissioned it once again through permanent housing. We had dedicated teams that would go and offer permanent housing to folks that were in our encampments. Some encampments maybe a couple tents, some maybe 100 tents. We found by offering the gold standard of alternatives in permanent housing that we got around 85 to 90% of folks living in encampments saying yes to going into permanent housing. And in many cases, we were able to go straight from the encampment, straight from the streets into the permanent housing. And so it's next slide. It's helped us decommission over 127 encampments with most folks going into housing. When you add that the house number plus the self-resolved number, that's when you get close to 85%. And you can see it's pretty evenly split between the different interventions of long-term housing with wraparound services of permanent supportive housing, and then the short-term rental assistance with case management of the rapid rehousing. But this was a proof point to show that, look, if you're saying housing is the answer to homelessness, then you have to show that housing is the answer to unsheltered homelessness, and especially encampments in tent cities. Next slide. And then, we were able to see, we started this coordinated, unified, housing-focused system in 2012. And in that first year of starting, we started to see major impacts. In fact, in Houston, we used to have more people on our streets than in our shelters. And in the very first year of starting, we were able to change that, to have more people in our shelters and on the streets. How did we do it? Did we build more shelter? No. What we did was we took the people on the streets and we put them into housing, and that brought our street count, our unsheltered count, below our sheltered count. But we started having major reductions in the first 4 years. Were a 70% reduction in chronic homelessness, and we had huge reductions all the way to 2016. And that was not by using pre-existing sources, but using those financial sources in a very targeted way. And utilizing best practices in a unified collaborative system. Then we kind of plateaued out. We all of a sudden had our first increase, you can see between 2017 and 2018, and that was because of Hurricane Harvey, where we experienced 500 additional folks on our streets because of the hurricane. And without new resources, we had problems getting back to pre-Harvey levels until 2021, and that's because of the COVID dollars. And so one thing that we would tell the community and tell the mayor is that we had this unified collaborative system, everybody playing specific roles, really high powered. It can house it can do really difficult, challenging work of housing a lot of people quickly. But for our issue here in Houston, that engine needed the resources, needed the gas, needed the money to run. And COVID brought those federal resources, injected it into our engine, and it's where we were able to get a 18% overall reduction in homelessness during the COVID years, including a 25% reduction of unsheltered homelessness in those 3 years of COVID. Next slide. And then, we really utilize this locally because, no matter what progress you make, folks are still going to want more. And we like that challenge. We thrive with that challenge. But sometimes we have to put it into context for folks and how we can compare to other cities by per capita. Even if we take out, we just don't look at the greater Houston area and we just look at the municipality of the city itself, we have one of those still the lowest per capita populations in the country. And it didn't always used to be like this. It's because of working as a unified system and going all in on housing first. Next slide.
Is this me?
Yes.
Okay. Okay, so last year in 2023, we saw a 17% decrease in unsheltered homelessness. At the same time, Houston was one of the highest cities on the third highest increase in evictions by more than 50% since 2022. So there's not a lot of data out there on what truly causes someone to become homeless. And there's a lot of concern about people facing eviction and that it's going to drive up the number of people becoming homeless. We do an interview approach to our homeless count, and we actually ask people what's the primary reason why they became homeless. And the number one factor so far has been an economic impact. They lost their job, and because of that, they were evicted. And so when we look at this, it's interesting to see that even though Houston had this huge increase in eviction filings, we still did see that 17% decrease in unsheltered homelessness. And that has to do with all of the housing that we implemented, as Mark mentioned, especially when we used COVID dollars to accelerate our homeless response system. Next slide. And then we, we're the fourth largest city in the country. We are revenue capped. We receive very little local funding for homelessness. The bulk of our resources comes directly from the federal government through the Continuum of Care process. We don't have zoning, but we do still have NIMBY. There's a lot of concerns from neighborhoods whenever we're trying to build something or set something up in a neighborhood, and it can delay things for many, many years. But we still were shown as one of the cities with a lack of affordable housing for those that are extremely low income. So you can see over to the right, this is the number of affordable rental per 100 households. So we're number 2 after Las Vegas. And so you can see that we still are seeing some of that affordable housing crunch when it comes to extremely low income individuals. I will address, though, I wanted to quickly mention our landlord engagement process because there are some questions in the chat about that. And so in 2017, 2018, while we were responding to the effects of Hurricane Harvey, we were dispatched to the disaster shelters to help move everyone out of the disaster shelters. The mayor and the apartment association president put out a call for landlords to offer up apartment units to house people out of the disaster shelter. And within 24 hours, we had about 3,000 apartments available that we put into an Excel sheet. So that was like a eye opener for us, right? So we're like, we could totally do this for homelessness. So when we wrapped up Harvey, we actually hired our first landlord engagement manager, and the COVID dollars allowed us to expand our landlord engagement. So what we do is we do offer a $1,600 landlord incentive fee, which is about to go away because we're running out of funds. So now we're going to start talking about double deposits. But our landlord engagement team, their entire purpose is to be on the side of the landlord. They are essentially the case managers for the landlords. They go out and they recruit landlords. They demystify the assumptions around housing, such as we're not going to just drop somebody in an apartment and leave them. They are the point of contact for landlords. So if there's an issue, they will reach out to landlord engagement because one of the things that we heard from landlords is that they never know who to contact if they're having a problem with the client in one of their units. And so the landlord engagement team plays that role. They also do They help them, for example, if there's a voucher packet that needs to be completed, if there's a the request for tenancy application from the Public Housing Authority. Some of those are very confusing, and so our landlord engagement team will actually go out and help those landlords complete those packets. We have regular landlord work groups where they can come in and talk about any concerns. But any landlord that we onboard onto our system, they do sign an agreement with us stating that they will waive some of the criminal background restrictions and that they will agree to not evict someone. Instead, they will come to us and allow us to move that individual to another unit so that we can use that unit for someone else. So it's a mutual rescission. It doesn't leave, an eviction on that person's record. So definitely landlord engagement has been a game changer for us and something that we're going to continue even after COVID money runs out, because it's something that we recognize is very, very important to our system. Next slide. And so some lessons learned over the years and putting all this together, we get asked this a lot. So first, we have to set goals. You have to set goals together, make it public, hold ourselves accountable. This also trickles down to the projects and the contracts. Restoring community support and housing first is a big one. So permanent supportive housing requires the unit, the rent, and the subsidy. You cannot have housing first without all those three things. It's not housing only. And so the proliferation of encampments that we had impacted the public's perception of housing first. And so we wanted to make sure that we showed that that as we're housing people, we're also wrapping supportive services around them and not just putting them in a unit and never seeing them again. We have to be data driven. We are very, very data driven here. We're not feeling driven. It's easy to let a single event or a situation drive a system, but we can't let that happen. We have to follow the data in order to see the trends. So I always say, what do the numbers show us? And then we can make informed decisions based on that. Next slide. And then lastly, building the plane as we fly it. We have to try something new, but it means that we have to adjust along the way. So it doesn't mean that you're failing. It just means that you're learning and you're evolving as a system. The work gets done in an inclusive work group setting. It doesn't get done by the steering committee, which is the Continuum of Care governing body. The work actually gets done by the partners. It's very transparent. And the lead agency guides those work groups, and any of the work that's implemented goes up to the steering committee for a vote and a formal implementation. And then lastly, you have to be okay with being uncomfortable. So at no point is everyone going to get what they want, but we can do more together collaboratively. Learn what really matters to the other side and be willing to let some things go in order to achieve a larger goal. And that is all.
Thank you so much. That was great, you guys. And shall everybody now come into the conversation? Should we bring everybody in from the New York side too? Let me begin by asking some questions. There are already a whole lot of really fascinating and useful questions that have been asked by the audience. So I want to be able to get to them, obviously, or at least as many as we can. But let me begin by trying to get you to describe a little more the process in Houston. And let me just begin by my own experience, if I could, because I ended up in Houston. I spent more than a year really looking for a place to examine that had made progress on homelessness in the country. Because I had been hearing from people, maybe some of the people on this presentation or listening in, that actually homelessness was something that we can address and make progress on. And I felt that there was a general widespread sense of despair and hopelessness around this topic, and that progress depended on some public understanding that there was a way to move forward on this, and that if people did believe that there had been progress somewhere, that maybe this was something that the public would want to invest in and would have faith that could be achieved in their communities too. So I looked around and I wanted to choose a city that was large enough to forestall some of the problem that probably we all felt looking at George's early presentation which is that when you're looking, especially here in New York, when you're looking at almost any place else except Los Angeles, the scale of the problem just makes everything seem sort of not like the same issue. 650,000 people at the pit count, and New York City compared to what was it, 10,000 or 88,000? I'm sorry, here in the city. What am I talking about? And 3,270 in Houston makes it seem like we're talking about apples and oranges. But Houston is a very big city, and I think the chart that Anna showed, which is that there's been a huge percentage drop over these 10 years, is the really crucial statistic there. That relative to the size of the city, Houston is, an extremely big city, the fourth largest in the country, as Anna said, and it has reduced homelessness by over 65%. So I felt I'm giving this speech because I think one of the things, Anna, you touched on, Mark, you too, was the sense of the relationship of public perception and buy-in to the ability of homeless service providers and municipalities to find, common ground, essentially, and to come together around projects. And I want to get back to that issue about seeing, what people see and how what they see on the street affects how they perceive how a city is doing. So if we could just touch on some of these things soon, but let me begin by asking a couple of questions to the three of you from Houston about those early days. So what you seem to be describing, and what I kind of understood when I was there, was you had one of the worst homeless problems in the country relative to the size of your city. That attracted federal attention. That created a kind of incentive for you to try to meet goals which were specific and targeted, but also was an incentive for you to bring people around the table. I noticed a lot of the conversations, or I'm sorry, a lot of the questions, or at least several of them, are about this issue. Like, what does that mean to bring people around the table? So Anna, could you, because New York's a very big city, and there are enormous numbers of different entities. So could you go into a little more depth about what it actually means to bring them around a table, and what were the stakes and problems of doing that? What were the conflicting interests?
I'm going to say a couple of things, but then I'd like to pass it over to Mandy, because she was around for that, and so she can see both perspectives. I will say on the provider side, there was a lot of distrust because of the fact that we were working in silos and no one really knew what everyone else was doing. Bring everybody together, but there was still the issue of like, really, are we really going to do this? All these years we've been doing it this way, and so that trust had to be developed. I will say also that being able to be in that room and share your concerns and having them be validated and not just dismissed was a big one. And then really empowering providers that were doing something right, and empowering those providers to do more of that, and those that were doing something not so right, letting them do what they do best. I think that the light bulb kind of went off on some of our partners when it's like, oh, that makes total sense. Of course, I want to do what I do best, right? And so they were more willing to let go of the things that they weren't doing as well, because of the fact that we were empowering them to do what they do best. Mandy, what are your thoughts?
I think that's really well said. We really focused on coalescing and finding consensus in the vision of the system we wanted to have, and got past all of the things or the deficiencies that existed today, which meant we could all work together toward achieving that goal. I can say in the back end, what was necessary in order to gain credibility among all of those providers, skeptical providers at first, is that we had to align government, we had to align leadership from all of their respective spheres of influence. So in our case, we had a very strong mayor. but we also needed to bring the private sector along in partnership with government and represent that this vision that the community was coalescing around, this was the vision we were going to fund and implement, and that there was going to be a place for everyone to come along in that process. And so then to reiterate something that Anna said that I think is really important is that when we cast that vision together, leadership took the responsibility to fund that vision and to place, right, powerful individuals like the coalition, like myself and Mark, in key positions so that we could really be the liaisons and support the implementation. But we didn't implement it. We equipped the providers themselves to drive that implementation in the work group setting. And I think it's really how we overcame some of that initial distrust that Anna was describing, but it's also how we maintained that entire network of folks kind of moving in tandem incrementally toward building our system. It also meant that we didn't have to bring everybody along all at once. Everyone wanted the same thing. Others, like some were going to be very early adopters and come along with us, and that's great because we were going to be able to move in phases. And so it gave everyone the space to come along as they needed. And the key to that is having leadership aligned so that we could create the container that allowed everyone to come along.
So I'm hearing a few things from that, and I Mark, if you wanted to add to it too, I don't want to step in too much, but one of the things that coming from the outside, really, one of the things I was noticing was you have system really that almost requires people to operate in silos. The fundraising processes, the organizational structures of all sorts of different providers, nonprofits, and so forth, mean that these people, these organizations, while all in principle working towards the same goal, also have their own interests and their own needs. What struck me about Houston was not that it was a sort of kumbaya moment and everyone said, yes, we should work together. You actually had a lot of people who were competitors for funds, people who didn't have necessarily the exact same interests. And what you're saying, Mandy, if I could translate a little, is those of you who can come with us and we'll work together, this is the way this is going to work. If you're not going to do that, we're not going to reject you, but that's not where leadership is. That's not where the main funding streams will go. That's not where progress will be measured. And I think it was a little carrot and sticky too. And some of the stick was carried, crucially, if I could echo what you're saying, by the fact that you had a very strong mayor, Marsh Parker, who made this a priority, really stood behind it, had life experience herself with a child who had experienced homelessness. And that leadership provided some of the crucial sort of weight. Is that a fair way to put it? I don't want, because in New York, there are 1,000 organizations. And I think the idea that people just come together in a room and agree on something is insane. It was a more complicated dynamic, right? Mark, maybe you wanted, because I think it still is, right?
Yeah, maybe I can start and talking about what it was, and Mark can talk about what it is. The reality is we had to form a center of gravity where all of the spheres of influence could come together and agree and support the plan. That is true for any city, but that center of gravity is going to look different in every city depending on those unique structures and dynamics. So in our particular case in Houston, the strong mayor system is both an advantage and a disadvantage, because if the mayor is fully supportive, then it is a natural kind of center point that everything orbits around. But if the mayor is not necessarily interested in the plan or the same strategies, then you really have some very almost impossible, kind of structural barriers to overcome. But in the case of Houston, the center of gravity started with our strong mayor structure, but it still required that we had to get all of those other spheres of influence aligned. And then we've had to hold that alignment throughout, for more than a decade through different administrations. And I think Mark has really been the individual who has held that together and put those strategies in place. So, Mark, do you have more to add?
You're on mute, Mark. Sorry.
I want to back up that. No problem. I want to back up because the reality is it really helped when Mandy was able to tell organizations that had been doing the same thing for decades to say, let's dip our toe in the proverbial pool and let's just try. There's no harm, no foul in trying. And if it fails, we'll go back to business as usual. And so that, helped overcome some of the hesitation that some agencies may have had. But when you have the mayor that's really focused on it, and we had alignment with the private sector and with philanthropy and the ecumenical sector, that's, in so many cities, the chamber's going in one direction, the county's going in another, the city's going in one, the homeless response system's going in another. But as Mandy said, coalescing all those spheres of influence was really important. One way we did that is the mayor at the time, this was really important to creating it, had a leadership team just focused on homelessness. And it had the cardinal of the Catholic Diocese and the head of the Houston Endowment and the president of the Houston Texans and huge national global developers of housing. And they were all on this. And it really helped create that influence, create that synergy we were looking at. The folk helped really focus where everybody's attention was going to be, create that kind of North Star that also helped align some of our programs. Some of the agencies got on board, early adopters, as Anna and Mandy said. Others jumped on the bandwagon once the demonstration projects rolled out and the success was showed. And then, last but not least, we decided to coalesce some of the purse strings as much as possible. And we needed to do that because we were trying to drive impact. So, when you have little resources for a major impact, really targeting those funds and making sure that there's not holes in your boat and funds are leaking out and going rogue and not supporting that vision to maximize that impact was really crucial. So if you wanted money from the city, you wanted COC dollars, you wanted money from the Houston Endowment or from the county, you had to be part of this collaborative, unified system so we can maximize that impact.
I mean, you've said a bunch of things there which are super interesting. And by the way, I'm reminded of an organization I believe called Search, right, which was in Houston, and I spoke to its director, who reminded me of what was happening around this time when Search, like a lot of organizations of that sort, was trying to sort of do everything. The thing that you offered was clarity, it seems like. So they were sort of losing money by spending their resources on everything, which they didn't have enough money for. And by sort of joining the team and figuring out their role, which was focused more on casework, correct me if I'm wrong about this, they were both able to participate in the system much more effectively and also get their own finances in order. And so that sort of was an example that I remember making sense in the same way. A sports team, not everybody plays shortstop and bats third. It's just that's not how you organize any entity. And what you're really describing, I think, you guys, is that you had a plan and then you had specific goals which you laid out that could be achieved and perceived publicly. Maybe you could talk just a little more about that too. I began with this question of public buy-in, and I think my perception of what you guys did that was very important was simultaneously targeting encampments, but housing those people in some rapid rehousing or permanent supportive housing. And then also creating these goals which were measurable and data-driven. Anna, you mentioned that too. So that people began to get a different really narrative about this and understanding. Could you just elaborate on that a bit, how those goals grew and what your strategy was? Any of you?
Well, I can talk about it from the very beginning. I mean, I think timing was on our side in that the first federal strategic plan to end homelessness was released in 2010, and it actually came out with some very bold goals that gave us the runway to align to those goals and to begin moving ourselves in that direction. And so that was very helpful. But what we had to do in order to hold that is we had to be tracking our progress toward those goals and communicating that progress in a cumulative way every week. And that was really my responsibility. I needed to make sure that the mayor was armed with, we housed this many last week, and now we're up to this many this week, because we had to create a drumbeat, both for the larger general public, that things are happening and we are making progress and we're going to reach our goals. But we also needed to build kind of the culture among all of those partners in our system, that everyone needed to come into alignment as much as possible if we were going to grow that number together, and that everyone was going to get credit for that number. And so that really supported this concept of getting everyone into the right seat. That instead of asking an organization to build out every component of a mini homeless response system so that any client they see, they can provide comprehensive relief to, we said, let's zoom out. Let's look at all of our providers as being part of a single system that's going to move individuals through it. And let's get everybody organized into their kind of highest and best use. And really, organizations self-selected into those roles. And I think your example of Search is exactly that. Search was trying to be, both the front door crisis response system and the back door for each of those individuals, and was struggling. And they said, we know where we can be most effective, and we know there are others who are more effective at the other parts. And our job was to say, how do we put it all together and reward you and let you get credit for what the collective is accomplishing, not just the small piece that you're contributing, because without you, we couldn't accomplish the whole. And I just want to root the goals were really important, but it was also how we kind of manifested that goal into the success and necessity, right, of every provider to be a part of that process.
Right, but didn't you also sort of make it, first of all, you have a different sort of corporate culture, I think, in Houston, which is quite particular to the city. I haven't touched on the things which I know New Yorkers are going to be focused on, which is housing availability and all this. We'll get to that. But there were particular qualities to Houston as well, which had to do with a certain kind of civic sensibility, which probably helped you get some of that private enterprise buy-in to also complement the federal funding you got. I think, though, what I sensed, though, was that you got buy-in in a general sense. This is a thing around which Houston can develop a sense of pride. Not that you solved homelessness overnight, but that you were making progress on something that had been considered intractable. And that bought you a certain amount of public capital when not everything was solved. Mark, does that make sense to you or no?
Yeah, no, I mean, it totally does. And, just like New Yorkers have a lot of pride in the city, Houstonians also have this can-do spirit. We put a port 50 miles inland. We put a man on the moon and built the first dome stadium. And Houstonians, when we like to do something, we want to go big and bold. And I think we've learned, maybe it's because of so many different natural disasters and crises that we've gone through, is that the only way to move the needle is by working together. And so when you take that can-do ethos that is grounded within everybody here in the city, and you put it together with this this spirit of collaboration that comes pretty natural, not all the time, but as natural as it can. You couple those two together, and that allows us to really take off. When Mandy started talking about solutions to homelessness, to an issue that everybody thought we couldn't make any headway on. And it wasn't just a pie in the sky. It was that here's the amount of dollars it'll take, here's the goals, here's the timeline for the goals, and it really made it feel like it was in reach and we could do it. And so much of it wasn't just dollars, and doing it in the way, while we're a progressive city, we're business driven, and so folks love talking about being data-driven. They wanted us to look at the ROI, the return for our investments of the interventions that we wanted to fund, really wanting to get the biggest bang for that taxpayer or private dollar. And they wanted to have continuous reports and updates. And they really appreciated that we were taking some of these business principles, but doing it in a very thoughtful, compassionate way to drive that impact and to get folks, off the streets and out of homelessness.
So thanks, Mark. I mean, I'd actually like to open this up, obviously, to our New York team and ask you basically, where do you begin to see? Because I'm sure you're thinking this is a different situation, a different kind of set of problems. Let me just ask, Cassandra, Alex, and Amy and Cynthia, what are the things that ring bells for you? But starting off with, where do you think Houston is not New York, I guess is a way to put it. What are you hearing that makes you think this is not possible here?
Oh, wow. Yeah. So thank you for having me here on this panel. I have to be honest, and looking at this, it does feel like how do we compare the two? But there are absolutely some wonderful things that I've heard that I think are definitely applicable to New York. But the reality is that New York has a robust shelter system, right? We speak about, Houston was able to bring 21,000 people out of homelessness over the course of a little less than a decade. New York City had to move 205,000 people from 2015 to 2023. And so when you compare it, our street population is very different in that right to shelter requires that we house every single person who presents at our doors, right? And so the people who are on the street have chosen not to access the shelter system for whatever reason. And there's a plethora of reasons why that could be. A lot of it is serious mental illness and, substance use disorder, and then issues with the shelter system itself. But the reality is that, the programs that we put in place are addressing a much larger problem, and has so many different moving parts and so many different interventions that sometimes it can be difficult for people to see where the progress is being made.
I think I just to add to that, I want to congratulate and commend Houston for the work that they've done and knowing how much goes into efforts like this. I think, for the past 2 decades, New York City has spent a lot of time and effort working on, working on our plans to end homelessness or significantly reduce homelessness, and have spent lots of time and resources and energy on many of the strategies that you all have been talking about today. And we've made, I think, speaking from my experience from early, 20 years ago, we've made a lot of progress. We've made a lot of strides. That said, there's a lot of work to do. And I think because of how vast and how big the system is, how complex the system is, and I think also you can't underscore what it takes to maintain. When you guys have done a remarkable job in figuring out how to maintain the momentum that you've gained from early successes. And I think you can't underscore how hard, how difficult it is to maintain that over decades. As you're evolving and you're growing and your cities are hitting one crisis after another, and you described that with Harvey and other other issues. But I think certainly for New York City, that's something that we continue to contend with, is how we both keep our eyes on and keep focused on what we know works. Philosophically and in practice, we're completely aligned with you all and with the housing first approach. But how we organize that, how we harness that in a city that's so big, and how we do that when we're also facing an undisputable housing crisis at the levels that we are in New York City, I think is massive. And I would say that, it's easy to say that the affordability crisis, the lack of affordable housing is the problem. It's a reality. Listen, if we weren't housing as many people as we were every year, and still had so many people experiencing homelessness, I think that would be a different story. The reality is just looking at the street population over the last couple of decades, we've had housed thousands of people from the street, and we still have an enormous problem. So it's not because we're not housing them, but we clearly don't have enough. So I think, that's a lot, but there we have it.
I will say that in New York City, one of the issues that our homeless have is, despite the Callahan consent decree, which is the right to shelter, that rule that consent decree actually really only covers homeless single men and women. Adult families and families with children are not specifically covered by the consent decree. Therefore, there's a lot of criteria that has to be met by those adult families and families with children to get into shelter. And so I'm wondering, what is the criteria for the homeless in Houston to actually get into shelter? We have a system where families with children and adult families have to prove where they've lived for the last 2 years. And if they can't prove it, they're caught in this loop, especially families with children, this 10-day conditional shelter, and every 10 days they have to go back to the AFIC office and go through the whole thing all over again, maybe get sent to a different site. And when they have children, the children are bounced from school to school to school. Yes, we have made some strides, but we still have a lot to do. So I'm wondering, again, what is the criteria to get into shelter in Houston?
Anna, do you want to take that, or Mark?
So first of all, we don't have a lot of shelter. And what we do have, as you saw, what we do have is very, it's small, and a lot of them are faith-based. Some of our larger ones are faith-based, and so they do put in requirements such as, so back when HUD put out their equal access policy, a lot of the faith-based shelters willingly gave up their government dollars so that they could continue to operate in their faith base, and so under their mission. And so what that means is that, you know, you have to, if you're a couple, you have to be legally married. You have to, you know, your name has to match what's on your ID, et cetera. And so because of that, there are individuals that are not willing to go into shelter. We don't have a right to shelter here, but we just don't have enough shelter for everyone to go into shelter right this minute, even if they wanted to. And so the bulk of the individuals that go into shelter are families. And the good thing, though, is that our shelter partners all do participate in coordinated entry. So we do train all of them. And even the faith-based providers will, you know, they may not assess people right away because they want to try to get some of the folks through their programs. But they still do assess people through the regular the Continuum of Care's coordinated entry process. And so those individuals are placed on our wait list, and they do get housed. And so the shelters that are not faith-based and as strict, they assess people on day one. And so they want to create turnover in their shelters so that more people can you know, go in. But the reality is that, you know, the intake is a certain time of the day, and they can only take X number of people. And so there's never enough, even oftentimes, for the people that are in line to get in. And so the only requirement is that you be home, you come in and you say you're homeless, really, that's it. Mm-hmm. And then we have started, you know, because we're trying to end chronic homelessness. And so there's a lot of HUD benchmarks that we have to meet. And one of those is to provide in-reach. So for shelters that don't have the capacity to conduct outreach or assessments, or they can't for whatever reason, or not willing to, we do send out our coalition outreach teams and some of our partner outreach teams to conduct in-reach in some of those locations to connect people to housing. That way they're not just in the shelter for a long time without getting connection to housing. And so that's kind of how our system, and then we don't have shelter in coordinated entry either. The shelters do their own intake. So the only interventions that we have in coordinated entry are permanent supportive housing and rapid rehousing. That's how we started coordinated entry in 2014. And again, because we just don't have a lot of access to, we don't have a lot of shelter capacity.
Thank you. Now, I have one more question. Here in New York, we have a lot of issues with being able to maintain adequate staffing in shelters. Is that an issue that you have as well?
It is, yes. Especially during the pandemic, our partners lost so much staff, especially the shelters. The night shifts and the weekend shifts are the worst. In fact, we even held, we put on several job fairs. So Continuum of Care, like the coalition, we, rented out a large space and just invited all partners that had multiple positions open to come to these job fairs. And then we just like publicized it as much as we could to try to get some staff for some of these partners, because yes, cooks for shelters, the night shift, the weekend shifts, those are very, very difficult to find. But regardless, the turnover in a lot of these organizations are, they're very poor. Some of it has to do with the fact that, unfortunately, some of the pay is not very high. One of the things that we always advocate for, and there's been a lot of articles that came out recently about this, and I think the coalition even participated in a survey, is we get, for Continuum of Care, because the bulk of our funding is from the Continuum of Care. We don't get a lot of local support. And so for the Continuum of Care, we get fair market rent increases every year because the fair market rent increases, but we don't get a cost of living adjustment for supportive services. So there are partners that have had grants for decades, and they're getting, FMR increases every year. And sometimes they're able to serve way more people because some of the rent don't even match the FMR. But unfortunately, they're having to fundraise or find alternative funding to be able to pay staff because the supportive services that they received was back in, 20 years ago. And so there definitely needs to be something at the national level where there's pay increases built into supportive services so that there could be adequate staff with adequate pay, because we don't want, unfortunately, the majority of people that work in nonprofits qualify for services, and we don't want that.
Mm-hmm. Yeah. Thank you.
Can I just say that? I'm sorry, Cynthia, please.
No,
Yeah.
Go ahead. I'll wait.
No, I was just going to say, as an outsider to this, one of the most striking and disturbing aspects of this entire giant challenge was the fact that you have so many caseworkers who themselves are, either were just homeless or on the verge of homelessness or paid almost nothing. I mean, so much of the public focus are these people who are outside on the street getting off the street, and then I don't have to think about them. But of course, this whole system collapses if you don't really have a robust, system of support. And that doesn't seem to be the same public understanding and therefore funding behind this. It's shocking, and I just say, as a journalist, it seems to me the most untapped issue here in terms of public understanding. The system can't support itself without those people getting better paid and more support. So sorry for sticking in my 2 cents, but
no, that's okay. One of the other major problems that we do have is source of income discrimination. We have a voucher system, which is at this moment called city FEPs, and there are different levels of qualification. And you had talked about earlier getting landlords to buy into your system. Well, we have a big problem with that. And a lot of landlords simply refuse to accept the voucher system or the voucher for a tenant, even though it's technically illegal, I believe, to not rent to someone because they're using a voucher. So can you tell me a little bit more about how you establish the buy-in with your landlords?
and if you want to take that, that's the question I was about to ask myself.
Yeah. So we
Well,
go ahead.
Mark,
let me throw this out real quick. I think we experience this the same. I mean, landlords don't have to take vouchers. Landlords here can discriminate for criminal background, and it can be a needle in a haystack because we don't have any really local funding, flexible local funding here. We have to find the unit that they're willing to take a voucher. They're willing. It's usually all bills. It needs to be all bills paid, and they have to take the client with their background. And so it can be a needle in the haystack, and it is a challenge. And we don't win all the hearts and minds of all landlords, but that doesn't mean we think it's impossible. And that's where, we really fund this landlord engagement team, the city and the county jointly funded there through the coalition, to leave no rock unturned. And where it's possible, the city's economic development officer is opening up their Rolodex. The mayor is calling and talking to landlords. While we can't force anybody, when you have a plan and you have big goals and you can demonstrate you can have a history of meeting it, then folks want to be a part of something that's exciting, and it's an opportunity for landlords. And that's part of the vision that the landlord liaison team, goes out there and sells to get those. But it's not all. It's a problem everybody faces. But how do you get around it to enough so that you can make impact? Mandy?
To put a finer point on this, just so you can appreciate the dynamics that we're operating in here. The city of Austin attempted to pass an ordinance to protect against this kind of income discrimination, and the state legislature promptly passed a bill that protected the right of landlords to discriminate against income. So not only are we up against just the general challenge and perception, but we have a state policy environment that is activating landlords to reject these pieces. And I just want to underscore, because this is something that we tested in Houston, and I so appreciate Anna talking about the experience with Hurricane Harvey and how it prompted, just like everything else in Houston, we're it sparked something and we're let's go figure this out and do it. It prompted us to really understand that we were engaging in the rental market differently. And we have gone out and replicated this in city after city after city, and it 100% works. When we stopped expecting our case managers, our social workers to go and find the units, and we created a dedicated landlord team, and they speak the language of landlords, and they're making business relationships with those landlords. And we're doing that by exchanging resources. All of the sudden, it changes everything for how that environment engages, because now we're speaking their language. And we are not speaking their language when we say, oh, we have this guy and he's really vulnerable and we're doing all this work, and please, will you make an exception to rent to them? We're making it feel risky.
Can I just say, if I understand what you're saying, you're also saying that as you speak the language of the landlord, also meaning that we, as an entity, will also guarantee that rent is there for you every month. We are a more reliable, potentially reliable renter representing this client than you might otherwise have. Is that some of the incentive as well? We will oversee the client. We will make sure the rent is paid, it's guaranteed, so forth. And what are you offering?
There is that. There's the we're going to pay it. And then you offer some incentives on the front end. So you pay for some costs that they couldn't otherwise get in the market in exchange for some leniency on pieces or things, or for turning a unit very quickly, right, to meet our timeline. I think the part that has soured individuals on vouchers is the very slow processing time and payment, receipt of payment that is oftentimes controlled by housing authorities or kind of other rent administrators. And so what we had to do is we had to go in and we had to actively manage our rent administrator partners in the same way. And that's where that dedicated unit team becomes really important, because now they're the case manager to the landlord. So instead of the landlord having to go and navigate the complexity of that environment, they call up, right, the unit person. They're I haven't been paid. And the unit person goes and figures out why they haven't been paid and helps facilitate those things. So it's actually, I think, it is the money on the front end, the upfront incentives, but it is the administrative partnership that I think ultimately cultivates the relationship with landlords. And I think Anna can attest to, once you were able to develop that relationship with a few landlords, they became our best ambassadors to go and recruit other property owners to participate in the process. I mean, we were intentional in that, but Anna, am I speaking out of turn or?
No, that's correct.
So Alex, you've been quiet. And I wanted to ask why and what your reaction is to some of this. What's your experience? You working in Queens? So tell me.
Yeah, I work in Queens. And, I think specifically for street outreach, I think one of the differences that we have for Houston and here is, I think, just the complexity of street outreach in the different boroughs, right? And I think that adds just an added layer of what services our clients are able to accept, because when you look at Queens, it's also, you're looking at public transportation, right? And so if we have an individual that's very much embedded in Queens that does happen to have the least amount of resources, you know, we have a lot of, or some of the end of the line subways, you know, and we're offering a placement in the Bronx or South Brooklyn, you know, you're talking about an hour and a half or 2-hour commute, right? And so it's bringing those resources right to the individual, right? And having that connection and that relationship with the community, right? And I know we were talking about earlier about the building that relationship and that buy-in, and I think that's very much important of the community seeing us on the ground, you know, in engaging our clients, but also engaging with the community and having these supportive relationships where if they're asking for help, we, you know, come in and we answer the questions realistically, because I think that's also the other thing that is sometimes missing with a lot of the advocacy work is, you know, realistically answering the questions that the community members have, the concerns, and not sugarcoating them, right? It might not be what they want to hear, but it's being realistic. And this way, you know, it's setting up those realistic expectations. So if it is a plan, you know, like Houston, where it took, you know, over 10 years that they first started implementing this, it was already said from the beginning, like, hey, these are going to be the realistic barriers. And it wasn't something that came as a shock because we were sugarcoating it in that way to the community. But yeah, I will say, like, I think one of the biggest barriers for New York, I'm interested to hear if it's kind of the same, because, you know, every city has their own neighborhoods, their own, you know, niches and like all of that people really want in that area. But yeah, in New York, I mean, each borough has a different makeup of what the street homeless clients are doing there, kind of their encampment setup and all of that. We can very much argue Manhattan versus Brooklyn and Queens has a very different makeup, right, of street homelessness, and therefore different needs. And each borough would require different level of advocacy, different level of resources being brought in. And again, it's, you know, getting everybody to the plate where it's like what's working, this safe haven specifically that's working in Manhattan might not work necessarily for Queens, right? So, but yeah, I'm also curious to hear how that affected Houston, if, you know, just the different makeups of different neighborhoods impacted the engagements and the buy-in from the clients and the community, because I think it's definitely something that is a big part of it here in New York City, considering the 5 boroughs.
Can I just add again, as a New Yorker who, you know, it was not, now I've been to Houston many times, but for those of you here in New York in on this who have been, Houston is an incredibly spread out city. It covers an area the size of Rhode Island. And it has an unbelievably terrible public transit system. So we think the 7 line to, you know, Queens is a disaster as the only line out there. I mean, in most places in Houston, getting around requires a car, or hours and hours and hours on buses. So it is not, Houston does not work from an advantage in that perspective. And therefore centralizing a lot of services or making them available, I think, is a really good question. But I just want to say that because I don't think, in New York, we're always looking for a million reasons why we're different and things are harder here. And that in this particular case, I suspect that actually this is more problematic if you're unhoused living in an encampment in a place in Houston that is not downtown. You're really, really on your own. So, but correct me if I'm wrong, you guys, from Mark or Anna, or Mandy, or don't correct me if you don't. I'm interested, Amy and Cassandra. So, okay, you both raised in the beginning this idea, sort of New York's intractably gigantic, and there's a shelter system here. We rely on that. So let me ask this question a different way, in a very general sense. So a colleague of all of yours whom I have dealt with over the last few years calls it the shelter industrial system, and which is probably a common term in your universe. But basically, in investing so much in this, we have created in New York a system that's makes it really, really hard to stress housing and pours billions of dollars in that shelter system. I saw what the total was before. Was it? Well, it was, George mentioned it. I don't want to waste time, but billions. What was it? 3.78 billion into the whole system. Just in a general sense, if you were to sort of think about, and in light of what the people in Houston are saying here, in what New York could do if you had sort of not quite a magic wand, but some ability to make some large structural changes. What can I ask you guys, what would they be? What fundamental things do you think you need aside from another 250 units of affordable housing? Are they data collection? Or are there some things that are practical enough in terms of sharing information, really sharing them?
I think that New York has tried to be very innovative. One of the things that I'm really proud of, having been doing this for 20 years, I started with families with children, spent the bulk of my career there, came to Street Homeless Solutions in 2020. But what New York has done over the past couple of years is really layer on the wins of the prior years, the wins of the prior administration. And so what I saw happen recently with street homelessness was, even though we went into a new administration in 2022, there was not the sense of let's throw the baby out with the bathwater, right? They were willing to look at what we had in place and to build on that, right? To add the additional resources, to see where the holes are at. And then the other piece that really gave us a leg up was the level of coordination that began to happen between the city agencies, right? And so it is unprecedented. You know, I've been doing this since 2002. And when I say the coordination between city agencies and the state is unprecedented, it is unprecedented. Also, the coordination with our non-for-profit partners, right? And so I think we have begun to look at the things that we know we need to do, and that is mainly what Houston is saying: coordination, centralized responses, right? So there's a centralized unit within DHS that works directly with HPD and all of the other city agencies around how do you deal with landlords who are discriminating around, the housing vouchers. So there's this coordinated effort that we hadn't seen before, but it has to continue to happen. And with the city being so big, it has to happen from administration to administration. You can't say, new mayor, let's wipe the slate clean and start from scratch. It has to be a continuum build on top of everything that's already happened, fixing what's happening and what's not working, and then continuing to move forward. So Mark's point about that coalition and that focus and that building is really important.
Amy?
Well, I guess if we're waving magic wands, then we have enough housing for people so that it's a right to housing, not a right to shelter, right? And or at least vastly reducing the amount of shelter capacity that we need. I mean, and it's also not a one size fits all. I think when we talk about our shelter system, the needs of the folks in the shelter system are very different often than people living on the street, or at least for the majority of them. There's certainly a subset of people in the shelter system that have similar needs to those folks on the street. So it's not a one size fits all either when we're talking about having enough housing, to significantly reduce our shelter population. And I think, an example, I mean, a couple of them, right? When we have 5 applicants for supportive housing and 1 unit for that. I mean, that the data is there in that regard. And that's an undercount because that's only the people that we know who are eligible for it. So if we're waving magic wands, that's certainly number 1.
So I had said, sorry, I'm just typing a response. I said, if you could wave magic wand, and the question and the thing you could do is not just produce an endless housing. So let's do your answers.
I took the easy way out. I took the easy way out.
Right.
But well, so some of the other ones that I think are really complicated. If we're not talking about just adding more capacity, which I'll always say we do need, but right. We do embrace a housing first philosophy. We do. We believe in that in New York City. We strive for it. We bring our entities together wherever we can to try and get to that, but we still haven't been able to do enough in that regard. When we have, our supportive housing, that so much of it is built with low-income housing tax credit that conflicts in many ways, right? The way that we build our housing, the way that the capital and the rental subsidy works in our housing doesn't align entirely with a housing first philosophy. It makes it hard to fulfill what we believe in doing. And then we're forced into coming up with these different ways of prioritizing and bucketing people. And we've sort of deaggregated so much then I think we kind of lose sight of the focus. So I guess it would be figuring out how to make greater progress in that regard, so that we can truly expedite housing, remove more barriers, and get people inside to the capacity that exists more quickly.
So let me begin to ask some of the questions which people have filed with us. And the first one is where you expect, which is a really good question. Many of our tenants are living with serious and persistent mental illness. The rapid rehousing program is for 1 year with an option for a 1-year renewal. What happens to your tenants in year 3? How do they get services? Where do they live? How do they manage to pay their rents once the subsidies end? And if I could just broaden on that, obviously, if you guys all want to elaborate on this issue around mental health, so much of the public conversation focuses on this. It's in some ways the most visible aspect of the unhoused, street population in New York City, even if it's not the majority or even a large, number of those people. Anybody want to pick up this question?
So for every housing referral that we send, we also send an income referral as well as a mental health referral if that is what the person needs. We learned that when we accelerated our housing during COVID, that some of these client supports needed to be beefed up. And so what that means is that, when people are being housed, they're being connected to those services from day one. And so we have our largest mental health provider is the partner that gets the referrals. And so they do home visits. If we start hearing about things that might lead to evictions or lease violations, then we contact them and have them go by. Sometimes the person refuses. They keep trying. And it's also part of case management, right? The case manager needs to make sure that that individual is connected to the support services that they need. And then, there are some people that complete a year in rapid rehousing and then they end up leaving and moving in with family. We have to remember that the exit strategy from rapid rehousing doesn't necessarily mean the person stays. It could be that they discover during their time in rapid rehousing that it's best for them to be with family, or it's best for them to, be sharing an apartment with someone. We typically, the only time we extended rapid rehousing was during COVID, but it's typically 12 months. And then we don't refer, we have a local vulnerability tool, a local housing prioritization tool that was developed here in Houston based on vulnerability for our clients. And so we have a range, and of course we looked at the data over the years. And when we first started rapid rehousing, we found that there were a lot of people failing out. And so we looked at the data to figure out why. And we discovered that there were some commonalities in some of the people we were referring to rapid rehousing, and they really needed more of a higher level intervention. So there have been times when, for example, someone is going to be okay as far as supportive services go, but will always need some kind of subsidy. So we've done moving on with vouchers. We have homeless preferences available, both public housing authorities, Houston and Harris County. And so sometimes when we have vouchers available, we'll do a moving on strategy where we'll just allow that person to have a voucher and then they exit supportive services. We've also done it, sometimes we call it Rapid Rehousing Plus, where we've done the same thing when we had an excess of vouchers. We tried that for a while, but really we try not to send those very vulnerable individuals to rapid rehousing. We either put them in non-dedicated permanent supportive housing, or likely they're experiencing chronic homelessness. We just have to document it, and so they go to PSH.
Related, I think, is this other question. How are healthcare providers utilized in Houston's housing plan to ensure that individuals receive needed healthcare services? What role do hospitals or community health centers play in partnering with housing providers to care for individuals? Does the city of Houston play a role in coordinating healthcare providers to housing providers, connecting, I assume? Mark?
I think Mandy was going to say something too.
Oh, Mandy, sorry. Well, you're both on mute, so.
I think generally in answering that question, I'll take a stab at that, but I want to say something that I think is really important based on the last question. So yes, we have healthcare for the homeless that is a really active partner in providing the healthcare services for folks. And of course, Anna described the behavioral health system connection that's been critical. So all of those things are being coordinated and overlaid into the system. But I think there's a really important kind of point in this, and there's a paradigm shift that's necessary for communities across the country. So it's this. We all make these judgments about individuals, what we think they need. And then we actually make the judgment to say, if we don't have the perfect package for you, we're going to leave you outside, or we're going to leave you in a shelter for a really long period of time. And part of embracing that housing first mentality and the ability to capitalize on lots of different kinds of resources is this idea to say, we're going to get people into housing and wrap them with services. And it might start as a limited subsidy, but then through that experience, we're going to get a much better understanding of what this person actually needs. Because the assessment I perform when they've been living on the streets for months or years and are in complete crisis could look entirely different 3 months into a stable housing environment. And so part of it is just stepping back from this like strict sense of like, this person only can go here, and saying, no, we're going to get everybody into housing and we're going to wrap them in supports. And then we're going to help them figure out exactly how long they need these subsidies and services. And then we're going to make the system deliver that. How is that any different than putting people in shelter for a year or longer, waiting on these same interventions to become available? The difference is this is a much healthier environment. We get a much more accurate assessment of these individuals. And so I think this is an important counterpoint to this unfortunate tendency that has developed in many systems across the country. Luckily, not as much in Houston because we've been at it for so long, but this idea of like, we're going to wait for the perfect thing to come along and we're going to let people stay outside to do it. And we've been fighting, like the marathon we've been running in Houston is people are only staying outside because we don't have enough. So we're going to get more and more and more as fast as we can and move people into housing as fast as we can. And we're going to figure it out from within that environment. And when we can get it right on the front end, let's get it right on the front end. But to Anna's point, we're not going to let that hold us back sometimes from pushing people into housing with supports, lots of supports.
And to Mandy's point, I was going to add to Mandy's point, recently DSS was able to do a street to home pilot. And what we decided was for the people who are living in the subway system, we have a vast subway system. We dedicate so many resources to street homelessness in the subway system. We would do a rapid response where folks would go straight from the subway into a single room occupancy supportive housing unit. And there was fear, right? Because these are folks who don't have documentation. You don't know what their income is. You have no idea who you're bringing in except for how they present, and you're putting them in a place that is permanent housing and hoping that they will comply after they get there to move forward. And I have to say, people had angst, but we said, we're not going to wait for everything to fit into a box. We're going to do this and see what happens. And we were able to fill 80 units, but I would say maybe 7 or 8 people who did not complete the program. And that was amazing because we were putting people in who had not had any of the assessments that were necessary to go through all of the steps to be approved for supportive housing, yet they were able to complete this process once they were placed in a permanent housing unit. So absolutely, I think that is a conversation that we know needs to be had, and ways to scale those type of programs are under discussion. Absolutely.
Sandra, can I ask you, do you have some assessment, does the city have some idea of how many people, what size of a population that is, who are basically the ones you see in the subway system?
The last Hope count, there was 3,700 people accounted for street homeless altogether in New York City.
Right. And but you don't separate that in the subways, but you were just saying, you know, that there's a large population there.
Yes.
Are you saying that that's a contact point, or is that a particular population?
That's a point in time count for our Hope count. Yes.
Yeah.
And we do have the subway numbers separately. I could pull those.
Yeah.
I would just echo and piggyback on what Cassandra is saying around that rapid placement. We know that that works. We agree. I think we want to be able to do more of that. And I think, again, you know, figuring out how to break through some of these eligibility barriers or contradictions around eligibility and the different funding sources is critical. Where we were able to do that most recently at Breaking Ground in partnership with several city agencies, we rented up our newest building in Dumbo that had nearly 500 units in total. About 300 of them were supportive units. And we did exactly that too. For all 300 units, we accelerated the move in, and we were able to move people directly off the street and from the shelter into that housing and did it in double time and did it, in about half the time that the process would typically take. So we know that it can happen, and we need both the ability to kind of dismantle or break through some of those eligibility barriers. We need to have the housing piece there, the 3 pillars that you talked about, Mark, right? We need to have all of those things lined up and make sense with each other so that we can do it, but we can.
And I think to that point too, sorry. To
please.
that point too, is also acknowledging those more complex cases that might present themselves. So we have those individuals that we can connect to rapid rehousing. And I think, one thing that we've done with Breaking Ground as well is we've also acknowledged the population of folks experiencing homelessness that are underdocumented or undocumented. And we took on, that challenge and creating specifically a pilot program of this is a very daunting task to take on, right? But we need to create some sort of path. We need to address this. And, part of that was also contracting out with immigration attorneys, because, one kind of theory that we had was, folks, I think, are not truly understanding that they are eligible for services because maybe they lost their residency card and they think that they're undocumented, therefore don't qualify for services. And we know it's a very daunting task, but we partnered with immigration services, knowing that it's not going to be a rapid solution, right? It's a long-term solution, but it's actually also putting in those services in place to try and capture that demographic of people that are experiencing homelessness in New York. And I would say for Queens, we have a very high demographic of those clients, but it's partnering with immigration lawyers to address an issue that is very complex and can take a long time, but we're not going to back away from it, and we're going to, take that on. And with that, we have been able to, at this point, since we launched this pilot program, at this point, it's 8 individuals that we were able to verify through working with immigration attorneys that they are residents, they are citizens. We've been able to house some in permanent housing that before we weren't able to, because we just didn't have that. But, it's not shying away from that daunting task of addressing folks that are experiencing homelessness regardless of immigration status.
Yeah.
Can I ask a question to Mandy or anybody from Houston regarding the undocumented? Do you in Houston have a pathway forward for housing the undocumented? Because it's almost impossible here in New York, except for the program that Alejandra was just talking about. Anybody?
So, we only have about 11 to 12% of the individuals that we serve that are Hispanic in the homeless response system. And we're not seeing a lot of individuals that are undocumented coming through the homeless response system. Some of that could be because we have a large Hispanic population in Houston, and there are a lot of social service agencies, nonprofits that cater to poverty. And so they feel safe. I know this having worked at one of those locations, and we saw a huge number of Hispanic, and those individuals, and being Hispanic myself, those individuals rally around themselves. They live multiple families in one room.
Yes.
And so they have some fear of the government, of government assistance, especially if they're seeking some kind of immigration service, thinking that might impact their citizenship or application. And so we don't see a huge number of those in the homeless response system. The ones that we do see, however, we are able, so if it's a COC funded, we have to remember that the only requirement for housing is that someone be literally homeless. And so I think a lot of times providers get in their own way. I did this a lot in the beginning with coordinated entry. With all of these requirements that providers put in place. Oh, you don't have an ID. Oh, you don't have a social security. I can't serve you. And so I actually submitted an AAQ to HUD about this, and I have it. And it's many years ago, and every once in a while, I'll pull it out. The only requirements for housing is that someone be literally homeless. And so they don't have to have an ID. They don't have to have a social security card or anything of that nature. Having said that, though, a nonprofit doesn't have to ask if a person is of legal status. And so if the rent is paid by the nonprofit, they can pay the rent for that individual as long as you're able to find a landlord that's willing to take them. Sometimes we use, we have so many great landlords that will take what we call a homeless outreach team ID, which is through the local Houston Police Department or the Sheriff's Department. They'll take those, or they'll take their own country ID, and we'll advocate for them, and they'll go ahead and lease the unit to that individual. But if it's tied to a voucher, so a government agency does have to ask about Social Security status. And so if it's tied to a voucher, then often if it's a single individual, we don't even refer that person to that project if they're tied to a voucher. We only refer to projects where the agency pays the rent directly. But if there's a family, for example, and only one person is undocumented and the rest are not, then the rent can be prorated. And so what that means is that they'll prorate the rent for the 3 individuals that are documented, and then, you know, that not for the person that's undocumented. So that's kind of how we do it here in Houston.
Well, thank you. That's interesting.
A question that came in related to this is the landlord, maybe we could get some quick answers from all of you to these things. Is the landlord engagement team grant funded?
So in the beginning, we funded them with private dollars, but they are now grant funded under the coordinated entry COC component. You can fund your landlord engagement. And some of you that received that SNOFO, the unsheltered NOFO, if you remember, there was a component for landlord engagement under outreach. You can also do it under that.
A question, I guess, to Cassandra too, is there, what is the plan now to expand the Street to Home program?
We are in negotiations with 3 other not-for-profit partners to bring on 300 to 400 units in the next couple of months. So we're steadily moving forward. And on the city side, there is also a landlord engagement program because we deal with voucher discrimination, housing, source of income discrimination. And so our staff are city employees for multiple agencies, DSS, HPD, and various city agencies, but that's a problem that we all deal with.
But Cassandra, can I ask you, because one of the things Anna was suggesting earlier is that, and I've talked to some of her team down there, that they're basically constantly going out and schmoozing with landlords, constantly going out trying to find the spare apartment here or there to, out of ignorance, I asked this question, how much of that is the job of the people here in New York who serve that same role?
They have teams. DHS has a whole unit called the rehousing unit, with hundreds of employees who are working directly with landlords and clients. So this is a big thing. Folks are working at every level, all the way up to City Hall, to bring people on board. We have 70,000 City for HEPS vouchers. If City for HEPS was put against other programs, we would be in the top 5 of subsidy programs in the country. And so to have 70,000 vouchers, you have to have people working day in and day out to bring these units on and move people into these units. So it is a full-fledged effort at multiple city agencies all the way up to the highest level to move these people out and to make sure people want to take these vouchers, because landlords have felt that they've been burned when the city has rolled out other programs that were in partnership with the state and the federal, and they pulled out and it all fell on the city. So we work really hard to reassure landlords that we're here for them, like they said, giving advances, giving bonuses, giving rent in advance, all of those things to get our folks into these units using these vouchers.
Thank you. A question for Amy. According to reporting in the New York Times, hundreds of tenants housed by Breaking Ground faced the threat of eviction last year as an effort to collect rental arrears by filing eviction proceedings in order to expedite one-shot deals. Do you plan to continue this practice?
So our eviction rate is less than 0.5% at Breaking Ground. The housing court system in New York City is used when necessary by landlords when there's non-payment cases or holdover cases. Although it's not a rule in New York City that you have to go to housing court to get a one-shot deal paid, we know that that's a process that expedites it. That's not a practice that Breaking Ground uses to collect rent, but it's that's part of the process. So when people aren't paying their rent in New York City, the landlords use the housing court system, to process that. But again, our eviction rate is less than 0.5%. We have on-site social services and our teams at Breaking Ground, as all supportive housing providers do, to work with tenants to ensure that they're able to maintain their housing long-term. People exiting homelessness who live in Breaking Ground housing have a 98% retention rate. So they're here with us for the long term.
Houston, does your COC have a lived expertise advisory board? And if so, in what ways are they involved and how are they making changes?
Yes, we have, in addition to our Youth Action Board for YHCP, we also have a Consumer Advisory Council made up of individuals with lived experience. Some of them are still currently in our program. They are paid out of our COC planning grant, which is allowed. They participate in various things. So for example, during the NOFO, they are some of the ones that are scoring new projects. They are part of the steering committee, the COC steering committee. Any action, so for example, we recently went through a coordinated entry revamp, and we're talking about like the intake line and things like that. We met with them several times and ran our ideas by them to see if it made sense as an individual with that had moved through the system. And so we go to them with major, like anytime there's any changes to the system, we'll go to them to, to ask their opinion and have them weigh in. Yeah. They're very active.
So we have time for one more question. I wanted to ask, this is, I suppose, specifically to Mark. One of the lessons I learned in pursuing the Houston story was that you are, Anna talks about building the plane while you're flying. You're also trying to sort of hold back your financial problems. You're constantly sort of just this is not a problem that is ever solved. It's a problem that's managed in the long run. The question is, what long-term factors, funding, housing, current trends are you anticipating could have an effect on the progress that you have had to date? Answer that any way you want, Mark, but you did raise the issue that your funding streams have depended on disasters. Nobody wants another one coming down the pike. So obviously, you are concerned about maintaining the progress you have achieved so far. Talk about that just a little bit to end this. What do you see coming ahead?
Yeah, great question. And this is when I start to get a little bit more pessimistic. Philanthropist John Arnold would say at the end of the day that taxpayers, get what they pay for. And that can be a difficult pill to swallow here in Houston, where the city really doesn't put any local dollars, because we don't have the local dollars to put into any social issues, let alone homelessness. And so when we look at 2022, over 80% of the dollars the city put into homelessness was actually federal COVID related. 100% was federal dollars, but even 80% was COVID related. And all those COVID funds are being exhausted. And so now the question comes in, we have that engine, we can pull off the impossible, we can house more folks, we want to do new aggressive goals, but the question once again is do we have the resources to do it? And most of the continuum of care dollars go to keeping the folks that we've housed. And if we want to house more people, it takes additional investments, and not just additional investments, just sustaining the investments that have been done before. And so it's exactly what you said. Right now, as perverse as it sounds, again, like we're hoping for another pandemic or a natural disaster just to fund the homeless response system, and for us to house folks at the end of the day and keep folks off the streets and respond to challenges with perceptions, then it takes sustained funding. We all know it's not like a pothole where we got a pothole, we can fill it, we can wipe our hands clean. It was a one-time investment, and hopefully we don't have to worry about it for years to come. But when it comes to individuals, when you place them into housing, you need sustained funding to keep them housed. And so, I think this is a challenge that the new mayoral administration is up for the task, working with the private sector and the homeless response system into how do we create sustained local funding so that we can keep momentum going and further drive reductions.
I'm going to end this here, though there are a lot of other questions. I wanted to thank you all and tell you it's a privilege to spend time with you, because I think all of the work you do is astonishing, especially because, as Mark says, it's never ending. So let me turn this over to George. Thanks, everybody.
Thank you.
I'd like to thank this outstanding panel for a fascinating discussion this afternoon. And Michael, thank you for your expert moderation and also for your professional interest in this topic. It is really important to have smart journalists who focus on homelessness and homeless policy in the United States, and we're grateful to have you as a fellow New Yorker and also as a wonderful journalist who pays some attention to this topic. So we appreciate that. I'd also like to once again thank MasterCard. These events are not inexpensive, and sponsorship is critical. Thank you to MasterCard for sponsoring our series of policy webinars in 2024. When you exit this afternoon, you will be presented with a short feedback survey, and we would very much like you to complete that survey. We take the answers very seriously, and we craft the way we do these seminars going forward based on the feedback that we get from participants. So please take a moment and give us your feedback about what you thought about this afternoon's event. We will also via email share the webinar slides and the Zoom recording. So anyone who was registered to participate today will receive the slides and the Zoom recording via email following this event. To explore a little bit more about the work that Care for the Homeless does in policy and advocacy and the conversations we prompt about policy about homelessness, please take a look at our CFH website, but there's also in the screen in front of you a link to get more information about our seminars, and also to learn more about the wonderful work that Houston's Way Home Coalition does. Please visit the link that's presented on the screen as well. Thank you again to the panelists. Thank you, Michael, and thank you for joining us this afternoon. And we hope you had a informative and interesting experience with us. Thank you very much.